What measures apply in the Netherlands to prevent the coronavirus from spreading? The Dutch government has implemented measures to prevent the spread of the novel coronavirus, COVID-19. For everyone in the Netherlands, stay at home if you have a runny nose or a cough, a sore throat or a fever. Avoid contact with others, social distancing. Limit visiting people with vulnerable health. Only call your doctor if your symptoms worsen, a fever above 38 degrees Celsius and difficulty breathing, and you need medical assistance. People throughout the Netherlands are encouraged to work from home or spread their working hours if possible. For vulnerable people, the elderly and those with weakened immune systems, avoid large gatherings and public transport. People, in general, are urged to limit visits to vulnerable persons. Everyone in the Netherlands is asked to keep, as much as possible, 1.5 meters distance from each other, also when grocery shopping. For healthcare workers and staff in other vital sectors, much is being asked of you. You should stay at home only if you have symptoms, including a fever. If necessary, consult with your employer. Please do not travel abroad. Universities and institutions of higher professional education, HBO, are requested to offer online lectures instead of large-scale lectures. Gatherings of more than 100 people have been cancelled throughout the Netherlands. This includes public places such as museums, concert venues, theatres, sports clubs, and sports matches. Schools and daycare facilities will close from Monday 16th of March to Monday 6th of April. This concerns schools in primary education, secondary education, and secondary vocational education. For children of parents in, for example, healthcare, police, public transport, and the fire brigade, there will be care in the school and childcare facility. This way, their parents can continue to work. This care is free of charge. Teachers will organise remote learning for children who are at home, with priority for graduate students in secondary education and MBO. All eating and drinking facilities will close from Sunday 15th of March at 1800 hours until Monday 6th of April. Sports and fitness clubs, saunas, sex clubs and coffee shops will close from Sunday 15th of March at 1800 hours until Monday 6th of April. Travel advice for all Dutch people as of the 17th of March: do not travel abroad in the coming period unless absolutely essential. Can my children still play outside with others? From the data now available, children seem to be contributing little to the spread of COVID-19. They can, therefore, play with others if they do not have any symptoms that are consistent with COVID-19, such as a fever, a cold, or a cough. Large groups should be avoided. Are children a special risk group for COVID-19? At the moment, children almost never develop symptoms of the novel coronavirus. Therefore, children are not a special risk group. Children are also not a major source of infection for the disease. Is there sufficient capacity in Dutch hospitals? The measures of the 12th and 15th of March aim to prevent the spread of the disease. The measures can help to keep sufficient capacity in the hospitals. If many patients become ill at the same time, there may not be enough capacity to admit seriously ill patients to the intensive care unit. What is meant by group immunity? Anyone who has had COVID-19 is usually immune to the virus afterwards. This means that this person can no longer become ill from the virus. The bigger the group that acquires immunity, the smaller the chance the virus has of spreading. This also reduces the chance that the virus reaches vulnerable people. Group immunity builds a protective wall, as it were, around vulnerable people. What are the current numbers of COVID-19 patients in the Netherlands? See our daily update on our webpage for current information about the novel coronavirus, COVID-19.